Good morning, friends. I am Dr. Atul. Today we are going to learn Symphony Multifocal IOL implant in soft cataract by Topical Phaco. So this is my triplanar entry into cornea. I usually do limbal entry or sclerocorneal entry. After that, you just implant HPMC gel into entry chamber so that AC will be formed, and just apply some of it on the cornea too. Then start your Capsulorhexis. I usually start at 5 o'clock, 4 o'clock to 5 o'clock, and then I go anti-clockwise. So this is Capsulorhexis. It is going slightly out, but then I am bringing back it and completing my Capsulorhexis. I'm planning around 5.5 mm Capsulorhexis because I want to implant Symphony Multifocal intraocular lens. So here I am about to complete my Capsulorhexis. It's an well-centered Capsulorhexis. Well-centered Capsulorhexis is vital if you want to place multifocal intraocular lens implant. After that, these are 5-degree side put entries. I do bimanual irrigation aspiration, so I do 15-degree from diagonally opposite. This is hydrodissection to separate lens from the capsule. Good hydrodissection is important. After that, it's the time to dive into the antechamber with the Phaco handpiece. I'm using Stellaris Bausch & Lomb intersegment model. Removal of superficial cortex. Now I am sculpting the nucleus. After adequate depth of sculpting, I came out and now implant some HPMC, and it's time to divide the nucleus into two with the help of two dialers. I divided the nucleus into two parts and rotated two. Now it's time to Phaco one heminucleus. I am holding it, chopping it, and emulsifying it. After emulsification of one heminucleus, I am rotating the another heminucleus and bringing it into the Phaco, in front of Phaco handpiece, and then emulsifying it. After emulsification of the second heminucleus, I am removing epinucleus sheet. It's time for irrigation aspiration. I am using bimanual irrigation aspiration. Left hand there is irrigation, right hand there is aspiration port. Just hold the anterior lip of the cortex and bring it to the center. Bring it to the center and emulsify. Change your hands. Just hold the anterior lip of cortex, bring it to center and emulsify. Just remove all the cortex. There are still few fibers on posterior capsule. So it's time to do capsular polishing. I do capsular polishing with the help of irrigation port. Just rub it It's time to implant Symphony Multifocal Intraocular Lens. It's a very good lens with good depth perception with least glare, as far as my experience goes. So I implanted a Symphony Multifocal Intraocular Lens into the capsular bag. It's time to remove visco. Visco has to be removed thoroughly so that there should not be any reaction post-operatively. It's important to remove visco behind the IOL also. So take your irrigation port behind the IOL and remove visco from behind the IOL. So multifocal intraocular lens is well centered. Thank you very much for watching.